Good morning, everyone, and thanks for joining us for QI Power Hour. My name is Tracy Sharon with the Saskatchewan Health Quality Council. For those of you joining us for the first time, QI Power Hour is a free monthly webinar learning series hosted by the Health Quality Council here in Saskatchewan. We bring together improvers from a variety of sectors with an interest in improving health and an interest in learning about quality improvement related topics. I am joining you today from HQC's offices in Saskatoon on Treaty 6 territory and the homeland of the Métis. We also serve the entire province of Saskatchewan, which also includes lands within Treaties 2, 4, 5, 8, and 10 as well. At HQC, we acknowledge and accept our obligations as treaty people, and we are committed to work in partnership with Indigenous nations in the spirit of reconciliation and collaboration. And to hold us accountable to that, you can view our Truth and Reconciliation Action Plan on our website, which outlines the actions that HQC plans to take this year to advance the Truth and Reconciliation Commission calls to action. You can access past QI Power Hour sessions on our website at saskhealthquality.ca. While you're there, you can also sign up for our QI Power Hour email newsletter, where you can receive notices about upcoming sessions and details on how to register straight to your inbox. So you can do that on our website as well. We are very excited to see the continued growth of QI Power Hour throughout our home province of Saskatchewan, in Canada, and even abroad. And so we want to thank all of you for spending an hour of your time with us and for your commitment to ongoing learning and improving the systems you're each a part of. We are very much looking forward to your engagement and enthusiastic participation on this webinar today. While we're all in audio broadcast mode, you can engage with the content in the chat, and I see many of you have found that already to introduce yourselves, so thanks so much for doing that. Please continue to use the chat throughout the session to enter your thoughts, your comments, and your questions. We will have time for Q&A at the end, and we'll be monitoring that and bringing those up at the end as well. So please do feel free to participate in the chat throughout the session. And with that, I'm very pleased to welcome HQC's own Jennifer Wright as our speaker today. And Jennifer will be talking about standard work, a foundational starting point for continuous improvement. So Jennifer joined HQC in July 2011. As an improvement lead, Jennifer supports a variety of improvement initiatives and projects that aim to build quality improvement capability and report on quality of care for those living in Saskatchewan. She values any opportunity to collaborate and make meaningful connections with partners across Saskatchewan in efforts to improve health and healthcare for everyone. Jennifer became a certified lean leader in September 2014. Prior to joining HQC, Jennifer worked as a community nutritionist in First Nations communities within Saskatchewan and as a clinical dietitian in British Columbia and Alberta. She completed both her Bachelor of Science and Master of Science degrees in nutrition at the University of Saskatchewan. So without further ado, welcome Jennifer, and please go ahead.
Thank you so much, Tracy, and good morning, everyone. It's so great to see the number of people that have registered for this session, and I want to thank you for the opportunity to engage with you today around a foundational principle of quality improvement, and one in that my experience is sometimes overlooked, sometimes can be forgotten until the last minute, and truth be told, it can be one that can sometimes be misunderstood, sometimes given a bad rep, if you will, and that is around standard work. So listed on the slide here are some objectives I hope that we can meet during our short time here this morning. So we will explore how standardizing your work can support and accelerate improvement efforts. So explore that relationship with quality improvement. Of course, we'll define what we mean by the concept of standardization. And sprinkle throughout the presentation, we'll explore together what it is and what it isn't. And lastly, I hope to share with you some key considerations to keep in mind when you and your team begin or continue to standardize work. But before jumping right into exactly what it is, let's take a moment to ground ourselves this morning and starting with why. Why does standardizing our work even matter? So in prepping for this session today, I reached out to my colleagues to help me out. So I gave out 10 bags of Lego to 10 colleagues. Each bag had 6 pieces with the instructions to set a timer and build a duck. That was it. So what did the ducks look like? Well, the images I'm about to show kind of set the stage nicely for the rest of our session together. And in a moment, I'll introduce our panel of HQC ducks. But before I do, I just have one ask of you as participants. As I show you our pictures of ducks, I invite you to use the chat just so I can see people are logging in and sharing who they are. Thank you so much. And again, thank you for joining. But yeah, I invite you to use the chat function to let us know what stands out for you when you look at these pictures. Again, I'll just remind you if you are sending a message in the chat, just to send it to everyone so that we can all see. All right, and if I have any of my colleagues on the line here today that were involved in building these decks, I invite you too to share some of the words that best describe your experience in building this deck. All right, so let's take a look at these. So here are our first 3 ducks that came in. Please note that the color of the pieces may vary slightly just due to my limited supply of Lego, but be assured that the shape and the number of pieces given out were the same. Here's our second round of ducks. And finally, our last round of HQC ducks. So what stood out for you? I like Penny's comment. They look great. They were great. Well, let me tell you. Oh, thanks for that comment. All looking a little bit different. Gina, not the same. Thank you so much for sharing. These are all great observations. None are how I would have made a duck, right? Only one can fly. That's right. Yeah. Thanks, Jeff. These are really great observations here. Thank you for sharing. And you know, the point here being of this activity is really around, you know, if there's ambiguity and uncertainty on our work, like getting a bag of what seems to be a random bag of Lego pieces, it shouldn't be surprising that we get a lot of different outcomes. As in the case of this activity, there were in fact many different ways to build a deck, like you just noticed. You know, when I reflected on doing this activity, I was actually surprised, even though I facilitated very similar exercises in the past, but I've never used such a small number of pieces. So I thought for sure there would be an identical or a set of twins at least. But as you can see, it wasn't the case. I actually did get 10 different ducks. So did it really matter what the duck looked like? Well, I certainly had expectations of what a duck should look like. But I didn't clearly communicate that or train any of my colleagues to build the duck in that way. I just simply told them to build a duck, thinking this would be, in fact, just a simple task that didn't require any training. So as a result of not having a method to manage and communicate the work, I saw a lot of variation in our ducks. So some of you may be thinking here, so what? I'm not building ducks, Jen, and my organization. This is a very simple task. My work is much more complicated than building a Lego duck out of 6 pieces. And absolutely, I couldn't agree with you more. Most of us at any given time have more than one piece of work in front of us. And despite what sector we work in, whether it's healthcare, education, community justice, and so on, and what role we play, we all have work in very busy and complex systems. There's a lot going on at any given moment. And we come into work with the best intentions to do a good job. We want to provide high quality care or services to the people that we serve. And we know we have organizational policies, we have standard operating procedures. Sometimes they're living on the internet, sometimes they're printed out in a binder. They're somewhere. We have meetings, we have reminders, we have huddles, we have signs, we have posters, memos. We have a very busy workplace visually most times, all with the best intent to support us in doing our work. But we still see variation. Different people doing the same work are doing it in different ways. So why does this even matter? Well, we know that variation in how we do our work can sometimes lead to variation in the quality of our work. So the quality of care or service for our patients or our clients that we serve. So you might think about a time when you started a new job where you're being trained by multiple people on different pieces of work. Everyone showed you how they did the job, and they all were a little bit different. So which was the best way? It might be that you had to create your own way based on all the ways that you've been shown. And we know variation can impact patient and provider experience. I think of, in the context of healthcare, what if there's 4 different ways to admit and transfer a patient to 4 different wards from the emergency department? Having 4 different ways to perform the same process can cause frustration for staff and patients as we're trying to keep everything straight and avoid delays in people receiving care. So while variation can lead to a less satisfying experience and frustration, in some critical cases, it can even sometimes lead to harm. So, for example, think of how variation can impact patient safety in the context of hand washing, medication, administrative processes. And the one that always jumps out to mind for me when I reflect on standard work is the process of prepping for surgery. So we know there's a number of preventable deaths that occur during surgery, and that really developed, which some of you may be familiar with, the surgical safety checklist. So that 19-item tool, which was created by the World Health Organization and in association with the Harvard School of Public Health. And the goal wasn't just to create a checklist. It wasn't the checklist itself. It was to decrease errors and adverse events and increase teamwork and communication in surgery. So we know this checklist has helped in terms of reducing morbidity and mortality and is used across the world nowadays. I think the key point that I have here is that we need to acknowledge that the variation does in fact exist in the systems that we work. And it's not really that one person is coming into work and saying, I don't want to intentionally impact the quality of the job that we do. It's really how our systems are designed, and systematic problems require systematic solutions. We need a method to make it easier to do the right thing every time to ensure high quality outcomes. So this is where we can look to standardization to support our work and improve our work, because this is QI Power Hour after all. So standardization is a method we can use to build a shared understanding of what is the best way to do our work to get the best possible outcomes. I'm going to turn it over to you here. I would love to learn from you. What images or words jump to mind when you hear that phrase, standard work? And again, I'll invite you to use the chat and send it to everyone again. Consistency. Thank you, Sherry. Process. Common understanding, quality, consistency. Something that everyone can follow. Yeah, I'm seeing consistency, clarification, best practice. Automatically, I love that image. I automatically see the template right in front of my eyes as you speak. Thank you. Thank you for sharing. Time saving. Same process for everyone. Thank you. Yeah, I feel like all of these words are jumping out for me as well when I reflect on standard work. Training, yeah, training tool. Excellent. Thank you, Julia. There's a lot of definitions around standardized work, and I really like this definition on the slide here. So Mark Robin is an internationally recognized leader in lean and change management and continuous improvement methods. His experience in manufacturing and healthcare, and his definition on the slide here kind of jumped out for me. So he defines standardized work as the current one best way to safely complete an activity with the proper outcome and the highest quality, written by people who do the work. And while his definition is written in the context of healthcare in his book, Lean Hospitals, I believe it really can be applied across sectors because all organizations, regardless of where we work and the type of work we do, are made up of processes. It's how the work gets done. Another way I've heard others describe standardized work is relating it to using a navigation system. Standardizing our work provides us with the best way to get from point A to point B. Here are a couple of examples of standardized work. These ones are more clinical in nature. I feel that COVID-19 is a really great example that illustrates more emphasis on standardized work being the current one best way. We didn't know a lot about COVID-19 a few years ago, but knowing what we knew at the time, which wasn't a lot, we established some standardized ways at our work, in our communities, based on what we knew, in an attempt to keep us safe and to prevent and to try and prevent spread. But as we started to learn more about COVID-19, we had to continually adapt our processes based on what we knew. So they weren't the same as when we first started. The example on the right, so the example on the left is one just a hand hygiene with gel sanitizer example. The example on the right here is from Children's Mercy Hospital, and this is a piece of standard work on how to prevent pressure injuries on the face and head caused by PPE, so personal protective equipment. I like this one because it illustrates the need for standard work to be relevant and current. But I want to emphasize that standardizing work extends beyond clinical practice. The example on the left was created one here internally at the Health Quality Council. And we used to engage patient partners in events that we used to host in the past and continue to do so in this day. But this piece of work was developed to support those engaging with patient partners, and it outlined the best way that we knew at the time to support them to get approval and reimbursement for travel. But standardized work also extends into our everyday, which takes us into the picture on the right. So would our decks look different if we had an instruction book like this? Probably. So when we want to have consistency, which is some things I saw in the definition, standardization is really a way and a key to getting there. So being QI Power Hour, how does the concept of standardized work fit within quality improvement? Well, as per the session description that some of you may have read, I included the quote by Taiichi Ohno, who was the father of the Toyota production system, who said, "Without standards, there can be no improvement." So really, in the context of the quality improvement journey, there's a lovely relationship between standardizing work and continuous improvement. So when I think about continuous quality improvement, we identify an area for improvement, we start testing ideas, we find a better way of doing something, but what would happen if we didn't standardize that work and train people on it and ask people to do it in the same way? So most likely we would have people doing it in the old way, we would have people doing it the new way, and others might keep trying new methods that are not actually leading to improvements. Let's flip that now. In the absence of improvement, if we just document a current way of doing things without applying quality improvement, well, nothing really improves there and we can expect the same results. So I like this image to further illustrate the relationship between standardized work and continuous improvement. And the blue line illustrates that quality improvement journey. You start out by understanding how things are currently done, generate ideas for improvement, test, and once you get an improvement driven by data, this is the new standard. And we agree to continue doing this way until we test a better way, which we can see the PDSA, Plan, Do, Study, Act cycle. And we do it a better way, we test that, and we continually improve. All right, so now we talked about the why and the what, but how do we actually standardize the work? Well, to get started, we first have to bring together those that do the work and examine how we currently do things. To identify where we need improvements and therefore where we may need standardized work, we need a shared understanding of where we're starting from. And a great tool is to visually map out how the work is currently done and maybe familiar with some of them. I know it's familiar to some of you on the call. It can be a virtual process map or a value stream map. You can use different tools that can visually show at a glance where the process starts and ends and the sequence of steps in between in the order that they happen. So oftentimes we think everyone does a process the same way until we stop and study things more closely. What one person means by registering a client might not be the same way as someone else does. And similar to our HQC deck activity, if I had asked my colleagues to write down the steps that they did when building the decks, when I looked at all of them, they would be slightly different. So what I really love about the mapping out of the work visually is the conversation it generates among people. It's the opportunity to explore why. So why is it done this way? Why do you do it this way? I don't know. I didn't know you did it that way. And really start to unpack, what might be that best way. You can see what the work really is, what order it happens, the bottlenecks that occur, how long things take, who does what. But some instances you might find there's not really a process at all, and that's a great starting point. So this is an example of a process map. It's mapping out the process from when a patient calls for an appointment to when the patient sees a care provider. After analyzing the map, teams will often uncover places in the process where they feel improvements might be needed or might be inspired about what change could make improvements to the process and at what level. For example, you might feel like the whole process needs to be standardized. Or maybe after discussion, the team might find, oh, you know what, everybody's, the real pain point right now is that everyone's scheduling people a little different. And maybe it's taking one of these process blocks and mapping that out and working on that particular piece. So once the team has defined the process to improve, they generate ideas to test and collect data to see if changes are in fact an improvement. The end result of embarking on that quality improvement journey is that of an improved process, so a new way of doing things. And this is the new standard, that shared understanding of the current one best way to safely complete an activity with the proper outcome and the highest quality. So I just wanted to emphasize this point here that was in the definition that I showed earlier, in that standardizing the work is intended to be written by the people who do the work. It's not meant to be created behind closed doors, whether that's, by people who don't do the work or by leaders, and then we just hand it out later and say, this is how our new way of working. The intent of standardizing the work is really not to micromanage staff or tell them what to do. The intent of the standardization process and tools is to engage and support those doing the process to come together to define the best way of doing the process today until we find that better way. One of the key philosophies that I value most in improvement work is the one that, those that do the work are in the best position to improve the work. Engaging and communicating early on with staff in the development of standardizing work is the key to sustaining the gains that are made in your improvement efforts and towards building a culture of continuous improvement. So I might be wondering, well, it sounds really great. So should we look for every opportunity to standardize our work? Well, it clearly has its benefits. If you look across the literature and also to the leaders in improvement, there's a consistently strong message of don't standardize for the sake of standardizing. There needs to be a balance between strengthening the quality of our intended outcomes and the confidence in the processes versus it becoming a distraction to the work and not having that added value. And so if you think about standardization, it really doesn't come free. There's, the cost of getting it set up, think of the time and the resourcing in terms of humans coming together and going through the process of identifying and working together. And there's also the ongoing diligence in implementing and maintaining the standard works once we're done. So again, we want to standardize where it makes sense. So then what needs standardizing and what doesn't? So the answer to that question is when I come across another term that I've learned over my years in quality improvement, the answer is really, well, it depends. And, rather than the perspective that all work needs to be standardized to the point that we have zero variation to no, we don't need any standards, perhaps there's another way to think about it. And again, an image that was created by Mark Robin really resonated with me. So I'm just sharing it here on the slide here with the reference below as well. And maybe we need to think about standardization more of a spectrum rather than an all or nothing approach. So for example, if we have a piece of work or a task by which it must be completed in a certain way, in a certain order, otherwise it will impact patient safety or patient health outcomes, you would most likely be leaning to that right-hand side of the spectrum. And the task really should be done in the same way every time to get the best possible outcome. It would be essential to document very specifically how the work is done to reduce and, even better yet, limit variation. Let's look at the other side of the spectrum. So there might be other pieces of work that we do that doesn't directly impact quality, safety, or outcomes. So the sequence of how this work are done or how they are documented are most likely less critical and possibly ones that aren't worth standardizing. But we also kind of have a middle area here, the middle of the spectrum, where we have an important pieces of work where some standardization is beneficial, but there is less risk or harm or adverse impacts on the outcome. The thing I like about the spectrum is the level of standardization is meant to match the level of the task, and it can help us guide us to ensure the proper level of detail is documented in our standard work. Again, it's standardizing what makes sense to standardize at the right level to result in high quality outcomes. It's a key improvement principle, again, is simply let's make it easier to do the right thing and harder to do the wrong thing. So when thinking about standardizing work, there are some key questions on the slide that might help guide you and your team as you think about the process. Firstly, of course, the question is, what process do you want to standardize? Again, as we just spoke to, not all of them need to be. Then ask, what do you want to standardize? What is the purpose? What is the problem we are trying to solve with standardization? Does it improve quality, impact outcome, safety? And what level of standardization do we need here? Is it a critical task with no room for variation, requiring a high level of standardization and documentation, or is there flexibility in the process? And where does that flexibility exist? Again, relating to the level of the task. And lastly, we always want to identify who is responsible for that task. Okay, so we have a new standard and we need to document it. So how can we do that? What is the right tool to use to capture the new standard? Well, when it comes to standardization, there are several tools available to help us document our standardized work. There are work standards, standard work, job instructions, standard work combination, leader standard work, and all serve a very valuable purpose. It's, pulling the right tool for the job. And, given our short time together, I'm not able to unpack each one of these tools. I think rather just highlight here that there are, in fact, different tools that can be used. And, thinking back to the title of our presentation here, it's really getting down to basics and ultimately coming down to what are we trying to accomplish by standardizing the process. So this is something I've been working on internally here as we co-facilitate several learning programs virtually at the Health Quality Council. And I was finding it really difficult when I was switching to WebEx. I was switching to Zoom. We use MS Teams. And it's difficult to remember in the moment what all the things I need to set up prior to facilitating a learning session. And, I had a colleague who was newer to the organization, and she was learning how to use the different platforms as well. So we agreed as a facilitation team that it was really important to standardize the step to set up our all the things we need to do to set up for our learning sessions virtually on Zoom, so we could both deliver a high quality learning experience for our participants. So to standardize this work, I realized the value in using a tool to help make the process visual. So the screenshots might be a little blurry on your end, but if you're interested in the way this template looks, I think my friend here, Lisa, dropped a link in the chat, and you're welcome. It's a blog on standard work with an embedded template, so I invite you to check that out. And sorry, so I thought, it has to be visual. And so I did a lot of the screenshots there. And it was helpful in terms of rather than just having words, like share your screen. Well, where's the share button? It's different place in every platform that we use. And, when you're thinking about the setup, I learned that it was really important to document the specific details. So for example, when we set up Zoom as facilitators, we both have to have slide control, share the audio play so we can play videos, activate the chat, set up breakout rooms, all those things that come with online facilitation. And by providing the specific details on how to do all of this, it saved us scrambling in the moment just before a session start and was a lot less stressful for us as facilitators so that we could follow it the same way every time. And, when reflecting on that spectrum that I shared just earlier, the order in which we have the settings activated on Zoom, for the most part, don't matter, so long as they all get done. So I wouldn't be very far on the right-hand side of the spectrum, more so in the middle. And there is some flexibility in the process. So for example, I may choose to use my second monitor as being my primary screen. My colleague likes to use our laptop as the primary monitor screen, just more in comfort in how we deliver. But it doesn't change the quality of the sessions we're delivering. So the particular tool that I used worked well for the purpose and what we were trying to accomplish. So now what I find is that I'm able to set up quickly and deal with the unexpected things that we all know technology brings. Like the couple, the emails that trickle in a couple minutes before the session starts that people are having problems logging in, or I don't know, those times when the entire system crashes just as you're about to start. The key takeaway here is just really to use the tool that best supports the work and to help your team achieve the goals. So with the tools and methods of improvement originating from manufacturing, sometimes there are concerns raised that we aren't building cars on an assembly line, and there's thought that standardizing work can be too restrictive. And I think it's true that many of us provide care and services to people, and people present with unique circumstances or symptoms in unique ways that will always require the knowledge and skills and critical thinking and decision making that's why we do our jobs, and we bring it to work every day. But we also know from evidence that many of our practices, even in healthcare, can and should be standardized to improve safety and quality. So standardization can be seen as a method to help translate best and evidence-based practice into action. So at the start of today's presentation, I refer to standardizing work, excuse me, sorry, similar to that of a navigation system. So the best possible way to get from point A to point B. So let's build on this. You can think of using standard work like using a GPS for travel. You plug in the coordinates and it provides you with several routes, the quickest, most efficient, most scenic, less lights, whatnot. But we can't blindly just follow the GPS instructions while we're driving. We have to think about what we're doing, and we still need to critically think about the instructions and use our best judgment. So, and also I feel like with standardization in our everyday work, we complete several processes and are faced with multiple decisions, thousands of decisions. And standardizing work can help support the everyday, just like I was sharing the example that with the piece of work that I just recently created. We know the stuff that happens and comes across. We know what to expect in our daily work sometimes. It happens quite often. So we can help free if when we standardize these pieces of work, it frees us up to tackle the more uncommon problems that, well, the ones that do require more critical thinking, time, and energy. Excuse me. And I was just thinking about an example and really think about, a process of referring perhaps a client to a program can follow a sequence of steps. However, deciding which program is the best fit for your client requires you to meet the needs of that particular client who's sitting in front of you. So documenting the standardized work is not the end goal. It's one goal and a step to getting there. But the goal, again, is just to consistently provide high quality outcomes, improve the quality of our care or services, whether that's safety, reducing error, saving time, reducing duplication of efforts. It's the goals that's set up out by your teams in terms of what they want to accomplish. So we standardize the work. Now what? Are we done? Well, not quite yet. We need a way to make these changes stick and support staff in learning and using in the daily work. So this really includes engaging and communicating with those involved in the work from the very start, as we talked about earlier. So we will need to decide how we will implement the new standardized work. How will we train staff? Just handing over a document with the steps may not be enough to sustain the process in the long run. It's often helpful to include the why. It helps people remember steps, understand its importance, and makes it less likely to be skipped over. When I was thinking about this and reflecting on this, I was thinking, one of the examples that everyday examples that jumps to mind, if anyone is like me, I buy IKEA furniture, and on the instructions they show the little person assembling the furniture with a pad underneath. The next image is a picture of the person assembling the furniture without the pad underneath, and it shows that the furniture breaks. So it helps me understand the why. It's important to follow that step, so I'm less likely to assemble my furniture without that protective pad. It's important to keep the work visual, keep it posted to where the work is being done. Make it easy to do the right thing by having it close by. If we have to go searching for a document on how to do the work, it's less likely, especially given the busyness of our days, that it will be followed. So again, let's set people up for success and have it close by. Oh, another thing on the slide here, I noticed that communicate. I always say is communicate 7 different ways, 7 different times. And communicating right from the start of the process of standardization right to the very end. It can certainly help with sustaining the gains. We will also want to think about a process for regular review and updates to ensure standard work remains relevant. If it's not followed, we can pull out our quality improvement tools of exploring why, getting to the root cause of why is it not being followed. Is it because something's changed in the process, so the standardized work isn't relevant anymore? There might be lots of reasons why. So once work is standardized, it's not meant to be this one way until the end of time. And as per the previous slides, it should be seen as the best current way and the basis for improvement. We don't want to change standard work for the sake of changing standard work, but when an opportunity to improve the current way exists, we can certainly test those ideas, gather data to see if in fact it is a better way, and then, like our image we showed earlier, standardize that new process, and it's a new way of working. All right. So this slide sums up all the key concepts we spoke to this morning. Overall, I feel like standardization benefits the organization by reducing variability, improving quality, can benefit staff by making it easier to learn new processes and protocol, and to engage in improvement efforts. And, it can even benefit the clients and the patients that we provide service through, by improving that quality of the care and the services and the experiences that they receive. So there's lots of sources out there that are beneficial. I have a few listed on the slide and certainly have more tucked away on my desk. So I just want to leave those with you, and these slides will be made available, I believe, on our website along with the recording if you want to refer back to those. But again, I want to thank you so much for joining me this morning, and my contact information is on the slide. If again, this was just getting to basics around standardized work. There might be further details and questions and whatnot that we can always jam about later on if you want to reach out. But yeah, I'm going to pause there and let Tracy facilitate our Q&A session.
Great. Thanks so much, Jen. Great presentation. A couple of things that stood out to me. The metaphor of a recipe came to mind for me, and some of my biggest cooking mishaps are when I miss pieces of the recipe, and so it always gives me, no matter how many times I've made something to go back to and say, did I catch every step or did I miss anything? The other is the potential, at least what struck me, is the potential for reducing some of the mental burden of the work. The example that you gave of choosing a service to refer a client to using your best, clinical or judgment. But then having some standardized work to refer that person to the service just saves me a lot of, me or whoever's doing that, a lot of mental energy in making that referral and doing the work so that we can save our brain power for the most difficult pieces of our jobs. So those were just a few things that stood out to me. We did get a question in the chat, and the question is, would job safety analysis be another example? And job safety analysis wasn't a term I was really familiar with, but I'm going to do a little interpretation here to say I think that would be a process by which you'd analyze each step or task in a process or a job to look at the safest way to do that step or a task. So Jen, just wondering if you have any comments on the similarities between that and standardized work.
Sorry, must unmute and return the mic to position. Yeah, thanks for that question. I think that came in from Amanda. So thanks for joining the call today. Yeah, I'll have to say that I too, it's a term that I'm not familiar with, but it certainly sounds from, if it is what Tracy was in terms of her interpretation with it, I think that definitely could be, it certainly is another tool. Again, it's the way to be able to document the sequence and steps and analyzing the best job. And if I'm not interpreting it correctly, just let me know in the chat, or I'd happy to be able to chat more with you. I'd like to connect again about that.
Excellent, thank you. And we've got some more things popping up in the chat here, which is great. So anyone else who has questions, please feel free to put them in. We have lots of time to take them now. So while you're thinking about that, we'll do another question from the chat. So over the presentation, we've come across standardizing work and work standard and also standard work. Can you briefly clarify these terms and how they differ?
Sure. So I will probably won't be able to do all of them. I think, the terminology can certainly be tricky at the best of times in terms of interpretation. I feel like standardizing work is the process to developing the standards. And then when you look at standard work, we often see that, especially in our healthcare folks on the call, and please call me out. And if I'm getting it, just digging into my brain here, the standardized work, is intended for writing out the stats, but also having the time. So time is a critical element. So again, standardized work is a really great way to go out to the floor and observe how it's being done. And the standard work is one tool that we can use to document how the work is done and actually capture we can refer to it as cycle time, the time that it takes to complete the work. And what's the benefits about that is that, I think, one example about that in terms of assigning time to it and to one operator of the process is that you think of room turnover, or when a patient room has to be cleaned. When we better understand how long it takes, we can better manage the work around that. So we know disinfectants have a certain amount of time that they need to sit for it to work. So if we're able to document that and have the times, then it can help make it visual and clear to those in the process about how long it should take. And if it's not taking that long, if it's shorter, we should be following back and checking out and exploring why, and just to ensure that we are, because we know that can certainly impact patient safety. So that's standard work. Work standard, let's flip the words around. But I view this as the tool that I showed earlier that I used for my Zoom setup. So this is one where it can be completed by multiple, so it's me and my colleague and whatnot. And it's the sequence of steps. It includes the picture, but it doesn't have a time element to it as well. So that's not there because the time isn't as critical in my instance in setting up some of my settings on Zoom. So again, various tools, various ways we can use them in terms of making sure that we set up success. But again, there's other pieces of work out there and other tools out there that might be helpful as well.
Excellent, thank you. It looks like Amanda's followed up in the chat. Thank you, Amanda. Okay. Just to thank you for answering the question. I think we did interpret that correctly, so that's great. And then Jeanette is asking, So, creating work standards, processes, and work instructions is something our organization is starting to create and are prioritizing. My question is, how would you suggest bringing staff on board for creating these standards and to show the benefits of doing so, since we want the people doing the work to create these standards? Great
Mhm.
question. I was wondering the same.
No, that is a great question. Sometimes it's hard to bring everyone together and have those conversations, but I think just creating the space to bringing people together and using a tool like mapping it out and exploring um, how it's currently done and just mapping out and I think making the work visual. Like I love all these tool and quality improvement and I think they accomplish great things, but I think the biggest benefit I see is the conversation it generates between staff members, between the people in the room. So it can be very engaging. And then, it can be seen as an engagement tool. It'd be like, okay, so we're, you know, let's map out the process. What does it look like? And probably it's a can take some time, but it's an engaging process along the side. And once you're done, you can see okay, so where do we need to improve? And then you can come together and identify where people feel like they should prioritize to improve. Like is it something like a big rock in their shoe? Is it impacting it, client experience and or safety? I guess on a construction that would be very important. Like are there some big things here that we should tackle first? And having just engaging staff and identifying and using their ideas, because again, those people that do the work are the best people to improve it. So I feel that just creating the space for people to come together and have those conversations using some of the tools can be pretty powerful.
Great. Thanks so much for those tips. Um, so just on the theme of challenges, I'm just going to skip over to the last or one of the last comments here.
Mhm.
And Michelle comments, I think the biggest challenges I've seen with the use of standard work is that we tend to miss the training piece. It's not good enough just to drop the standard work on someone's lap and then say, figure it out. I've seen standard work that's 4 to 5 pages long and is very overwhelming for folks. Just an observation I've had over the past while.
Yeah, thanks for sharing that. I think, internally we've seen that challenge as well, Tracy, in terms of, that creating a balance, right? Creating balance of improving the quality at the same time, making it simple and easy for folks to follow. Um, so I invite people. I know there's a lot of folks on the call who have experience with doing this in terms, and I would invite you to drop your tips down in the chat as well. So please do so. Right, your training is such an essential piece, and you're right. When we create long documents, we know that it's more a tendency to skip over, right? So, no, thanks for that.
Great, thanks so much. Yes, and great opportunity to crowdsource some tips and tricks here
Mhm.
in the chat. So feel free to enter those
Yes.
folks if you have some. And Amanda's followed up again with some potential examples. So a work standard or not something not time bound might be how to request vacation leave. Great example. Some examples of standard work could be huddles. So we know that we try to keep huddles short and within a certain period of time, as well as taking blood pressure. So some great examples there of the difference between work standard and standard work.
Mhm.
I'm
Thanks,
just going
Tracy.
through the rest
Yeah,
here.
and another tool to help with the training, I see some reference to multi-skills training list. We certainly have templates available, so certainly reach out to me by email. I'm happy to share what we have. But typically a multi-skills training list is the list of the standard work and then your staff, and then you can mark down who's been trained in what. It's just kind of helpful tool to at a glance see how the training's going. So thanks for that note.
Thanks for those suggestions, everyone. Just going to pause here. If you were thinking of a question, now's the time, or a comment, or a tip, or a trick that you can offer to the community on the call today. Now's the time. Please enter it. I'm just going to check our Q&A in case there's anything in there.
Sure.
Doesn't look like there is. Go ahead.
I do see one. What happens when
Okay.
you bring people together
Thank you.
and they all think their way is the best way? Oh yes, everybody does think they're the best way. I know in my house that is a constant battle I have with my children. But yeah, I think there there's certainly some strategies. I think one of the best things I think of when starting and embarking on continuous improvement is when you bring a team together to tackle this, is establishing those group norms about how are we going to come to consensus. Like, is there a decision maker who makes the call, or is it like a fist of five? I agree with this wholeheartedly. To no, I'm not going to go ahead with this, and so there's a variety of tools that can help decision making process. But I think the idea is to have the conversation about how decisions are going to be made. But I think in terms of there's multiple ways to do anything like building a deck. I often think about like, are there best practices that we can look to, and knowing that best practices aren't a plug and play, because depending on the context in which we work, but can we look to see what works elsewhere, bring it over, adjust, test, see if it makes an improvement, or is there some evidence, based practice out there as well that we can turn to and again bring to the area. So those are just some things that come top to mind.
Excellent. Thanks so much. Don has commented training within industry is also a powerful tool for eliminating variation. I don't know if you wanted to speak to that at all for those who might not know what training within industry is.
It sure is. I think the one example around training with industry that is very, still, around the hand washing, certainly a technique that I don't know if I could drop a link to, or Don, do you have a link that might be helpful to bring people to it to kind of explain what that, or to dig deeper into what that is? Sorry, some of the challenges with the audio broadcast. I'd just like you to speak.
Great. Well, we'll see if we see anything show up in the chat. In the
Yeah.
meantime, Michael is asking, can you speak to how idea generation fits in? I'm going to interpret that to mean like how you generate ideas from the team about how to do the work. Michael, if I've interpreted that incorrectly, please feel free to correct me in the chat. But do you want to talk a little bit about that? Oh, correct. Okay, good. Thanks, Michael.
So how we can generate ideas?
Yes, yeah.
Yeah, well, there's certainly lots of ways to generate ideas. Again, I think one things I love is a tool used idea generation sheet. Sorry, tongue twister at the, but bringing people together and just giving them the space to sit down and think about, how are things currently done? Draw a picture of it. What would good look like? And how would we get there, and then be able to generate those ideas. And one of the great thing about that is people individually reflect on generating ideas for change, bring them all together, and surprisingly there might be some really similar ones, and then we can have a bigger conversation about where we might want to start, or what would be the best place to start in terms of that. So, and lots of places again we can look to, whether it's best practice, evidence-based practice, look to our colleagues in Saskatchewan and beyond, because I know there's other people out there as well who all have great ideas, and it's just creating a space to come together, have people individually reflect, brainstorm, and then generating a conversation, and to use dot voting or some type of method to come to consensus about what we're going to try first. And I think the message for me is like, we're going to try this. It might not work. And we'll use data to see if it in fact is an improvement. And if it doesn't work, we're just going to learn from that. And we're going to keep trying. So again, that culture of continuous improvement. Yes, thanks, Don. I'm just going to drop the link for more on training within industry here.
Okay.
Quickly.
Thanks so much. Okay, I think we have time for one more question, and there is one in the chat. So Taryn asks, sometimes it feels like we create work standards to support team members that aren't accountable to tasks or duties instead of addressing those issues directly. Oops, sorry, I lost it. Causing the majority of staff to be annoyed by another work standard, and then it's a struggle to get engagement when a work standard is actually needed. So I don't know if you've seen this in your experience working with teams, Jen, but any comments on that comment?
Just going to read it one more time to make sure
Sure.
I have it right. So is it creating work standards for people that aren't
So I'm kind of
involved in the process?
uh, I think I'm interpreting this as creating work standards to maybe, um, to paraphrase, correct some performance issues in a particular individual. Maybe
Mm-hmm.
instead of addressing those directly, Taryn, again, correct me if I'm wrong, but instead of, addressing that with that individual. Any
Mm-hmm.
thoughts on that?
Well, I think, yeah, I think if it's, I guess, yeah, it's again, I mean, having those crucial conversation moments, I think, and I often think about, if we look at the process, is I don't know. I'm sorry, I'm trying to find my words to answer this in a way that might come across. I feel like if it's one individual, I feel like that's a crucial conversation and opportunity to have that moment. And I could certainly see that just creating a work standard and implementing it just because of that particular, but I mean, I would love to have that conversation with the individual. Why? Perhaps that work standard isn't being followed before creating a blanket work standard for everyone, because maybe there's something that person knows about the work or who does the work, that's something we maybe haven't thought or considered. And I think possibly having that, person engaged in the conversation of doing future standardized work might be another tactic, but I can certainly see some of the challenges that would present for other people involved for sure. It's a great question.
I love that suggestion, Jen, of exploring the why, because as you said, it could be that someone's actually found a better way, and we just don't all know about it yet. And so sometimes having that conversation can lead to improvement in the process that maybe we wouldn't have seen otherwise. And I think that's why it's so important to come to a team agreement about how we're all agreeing is the one best way to do this task or this process today,
Mm.
because we shouldn't be afraid. Accountability is not a scary word. We shouldn't be afraid of being accountable to each other for what we agreed was the best way to do the process. And so if there are deviations, we shouldn't be afraid to call those out and to understand why. Perhaps that person has found a better way of doing things. So yeah,
Yeah, and I
very
think
great comment.
and I like the thank you for Amanda for taking on to that in terms of maybe a different way I was thinking about it. But right, like if we don't have something written down and visual and something that we have trained, and we don't write the standard down, we can't really just say, well, you're not doing it right. Well, how would I know I'm doing it right if it's not, I haven't been trained or I don't know what the best way is. So absolutely, thank you for that perspective and adding that, Amanda.
Yeah, it goes back to that quote you shared earlier, without standards, there can be no improvement, right? Excellent. Well, thanks so much, Jen, for your presentation and for your great answers to all the questions. And thanks so much to everyone listening for your enthusiastic participation in the chat. I think we've all learned from each other today, which is awesome. Unfortunately, we are nearing the end of our hour, and so we'll need to wrap it up here. But Jen has kindly offered her contact information on the slide, and I know she's happy to chat or email with folks after if you'd like to ask further questions. So with that, I'm going to move us on to the conclusion of our session today. Um, and I don't know how many of you know this, but if you become a QI Power Hour speaker, you too could be the proud owner of a pair of I Heart QI socks. And I know we've got some new colors and designs on the way. So if you have an idea you'd like to pitch to the QI Power Hour team, please reach out and do so. We'd love to hear from you. And our sincere thanks again to Jennifer Wright from HQC for sharing her very informative and engaging presentation today. When you leave the webinar, you will be taken to an external survey provider site. You might see a warning pop up. Don't be alarmed. It's not a virus or a scam. We're just looking for your feedback. So we are continuously improving our QI Power Hour with your feedback. So we'd very much appreciate if you took a few minutes after leaving the webinar to provide your feedback on the survey for us, please. Thank you very much. And I want to leave a quick plug for our next QI Power Hour session that will happen on November 25th from 9:30 to 10:30. And this one will have Danielle Williams from Concern for Youth talking about QI in practice, engaging youth through mentorship, programming, and partnerships. Proves to be a very engaging and informative presentation. So we'd encourage you to come out for that QI Power Hour session on November 25th. And with that, I'll bid everyone farewell today. Thank you again, Jen, and thanks everyone for joining us. Until next time, take care, and we'll see you again later in November.